Dr. Jason Rivers is a clinical professor of dermatology. He also has a private practice in Vancouver. He is the former director of the Canadian Dermatology Association's National Sun Awareness and Skin Cancer Prevention Program. Dr. Rivers not only graduated magna cum laude from university, he continues to pursue excellence in his field. He's listed in Best Doctors in Canada. It is my pleasure to welcome Dr. Jason Rivers from Pacific Dermaesthetics to Studio 4 to tell us more. Welcome back.
Thanks, Fanny. It's been a while.
It has been a while, and you look exactly the same.
So do you.
Well, thank you. But I know as part of what you do, you believe in natural as opposed to stiff.
Or changed.
Or changed to changed.
Exactly. I think that people have a natural beauty, and all we're trying to do is reinforce that and recreate it.
And there's so much recreation going on, as you know.
Yeah, and you can do it very subtly, and you can do it without having to be invasive. So that's the fun part of it too. Sure.
How do you determine what to do? Somebody comes to see you, they're a little jowly, they have a spot here, a splash there. How do you begin?
Well, first and foremost, I'm a dermatologist, so I sort of assess the skin in general for any disease aspects, whether it's skin cancer or underlying conditions like rosacea or acne. And if somebody has signs of aging or sun damage, then we have different ways that we can deal with that, either through topical medications, through devices like lasers, or even things that you've heard of, I'm sure, Botox and fillers.
Sure, and there are many different kinds of fillers. There's a new lift called the vampire facelift, where they shake up your plasma or your something in your blood.
We take your blood and we spin it down in a centrifuge, and then we re-inject the platelet-rich supernatant into the skin, and that has growth factors which help stimulate new collagen.
It makes sense to me only because it's my blood, right? It's not a filler a chemist made up or a chemical of any sort. And it's my blood, so I would think my body would like that.
Right, and to date we haven't mixed up people's bloods.
Well, I'm thinking you should be there when they take it.
We are. I do.
Is that how it works?
Yeah, we take your blood at the time, and then we spin it down, and then you have to actually inject it within a few minutes of having done it, because it will coagulate otherwise.
Right. If somebody is over-injected, and we have seen that, and I know you've seen that, and there's just too much, does it go away? Can you somehow remove it? I've seen some lips you could land a 747 on.
Yeah, that's true.
I bet you have too.
Yeah, well, it depends on the product, because there are some products that are made of what's called hyaluronic acid, which is the same, it's kind of a complex sugar. It's the same material that's in our joints and behind our eyes. And there are chemicals that you can inject into the filler to dissolve it, and it can dissolve very easily within about 24 hours. On the other hand, there are some permanent fillers, which you got those 747s. Even when they're out of date, they're still going to be there.
They're still there. So what's an example of a permanent filler?
A permanent filler is one called Artisense. It's a collagen mixed with polymethyl methacrylate beads, tiny, tiny spheres about the size of a cell, and they stimulate your body's own collagen to form around them, which gives it the permanency. And it's a great product, but you have to know how to use it properly.
When you began in dermatology, what were the options to looking younger, filler-wise, surface-wise?
Well, I mean, I started 30 years ago almost, and so it's been a lot of transition. At that time, really, there were a few lasers in the infancy of laser technology, and those lasers, in fact, if you were not careful, could really burn and scar the skin. That changed in the mid to late 80s when the science changed, and then the technology rapidly followed that. Fillers, there was only collagen, and interestingly, the fillers that I talked about today, these hyaluronic acid fillers like Juvederm or Restylane, they can last a year or more in the skin. When we started to use those, and we're talking about in the ancient past of the 20th century, you know, the 1990s, sometimes we had fillers that could last literally a few weeks. That was not very happy for the patient or the doctor.
Right. And so if you're getting something filled, give me an example of what you would get filled. Hello?
You don't need very much, Fanny, don't worry.
Oh, good.
The key thing is...
I'll just sit like this and talk to you, okay?
That's perfect. The key thing is that when you use filler, it depends on the area of the face. So When we start seeing descent and the jowls start to form a bit, that's because the cheeks are actually losing volume, they're losing fat, the bone's resorbing. So by injecting the cheeks, you can lift everything from below. We'll inject the nasolabial folds, the area called the marionette zone, even the hollowing of the temples. So there's all kinds of areas that you can fill.
Really? So I like that, the marionette zone.
We used to call it lines, but
Lines, but now it's, you have a bit of a marionette going on, do you? But you would think with a puppet, if you pull the puppet up, why not?
That's right.
There are a million ideas under the sun, as you know. Once there was a string facelift or something where they would put string
that was
underneath the skin and you'd like tuck it behind your ears.
That's right. And in fact, those types of threads, actually, they were like a fishing hook. You'd put the thread in, they had a little barb, and you can just go back. The problem was that they happened to break at times and migrate. And so it didn't look so hot after all.
Right. What's the difference between working on a male's face and a female's face, aside from that you're male and female, but the different treatments that one perhaps works with a man, one works with a woman?
Well, in fact, it's pretty similar. The difference is, however, that the dosing you need, the amount of material you need may differ. A lot of the changes we see on the skin are related to sun damage, and that affects not only the pigmentation of the skin and the texture of the skin, but also the collagen and the elastic tissue. So you start seeing wrinkles and folds.
Right.
And you can treat men and women quite similarly in terms of the material. Where you put it, how much you use is different.
And skin color?
And skin color as well. I mean, with darker skin, the pigmentation helps to protect against sun damage. And so darker skinned individuals will look younger, longer, all things being the same, but they too are susceptible to sun damage. And if you do start to treat them with energy devices, you have to be careful because you can cause hyperpigmentation.
Sure. My African-American girlfriends and boyfriends, I say, when I come back, I'm coming back black, if you don't mind. And they always say back to me, black don't crack.
That's right. But, but even black individuals, too much sun can get sunburnt. And I've seen individuals who've had skin cancer, even though they're
So Asian, it doesn't matter the ethnicity, you should watch for skin cancer.
Yeah, of course. But it's a lower rate than in Caucasian.
Is there a way today to reverse sun damage?
There is to some degree, and the first thing is prevention with sun avoidance and sunscreens. They do work against sun protection, reversing sun damage. Second thing are topical retinoids. Vitamin A acid products can have an effect on sun damage. There are a lot of cosmeceuticals out now that will have an effect to some degree, at least in a laboratory setting, to show that you can reduce signs of damage by stimulating collagen. And then, as I mentioned, we have a lot of different energy devices like lasers, intense pulse light, that can all have an effect on reversing sun damage. And interestingly, even stimulate new collagen. That's the interesting thing to me, is that you can take skin at most ages, somebody in the 70s even, and have a rejuvenation of the skin.
When you say rejuvenation, plumper,
smoother, pore size decreased, tighter.
And does that last a year, 2 years, a week?
No, it can last for years if you take care of your skin and if your health remains good. And another aspect, of course, besides the sun is smoking. People who smoke will have definite changes to the skin that will deteriorate it.
What can you tell about what's going on inside our bodies, in the liver, in the lung, by looking at
the skin?
The skin.
Well, I mean, it's an interesting question, because that's one of the things that really intrigued me and got me interested in dermatology many years ago, because when I started off in dermatology, I was doing my internship in the Maritimes, and there were literally 4 dermatologists for all the Maritimes. And so we saw everything in Halifax that, was under the sun. And you can see all kinds of things. So, for example, with your liver, you can see yellowing of the skin, you can see changes to the nails, you can see changes in blood vessels on the skin. In people who have kidney damage, you can see changes in terms of itch. They can have bad itch, nail changes again.
Itch, you said?
Very bad itch.
If your kidneys aren't functioning, you itch?
You can, yeah.
Really? Like a rash, or?
Just itch. And same thing with your liver. If it's really bad, you can get itch with liver damage. You can get, I can go on and on, whether it's obstetric problems, whether it's pediatric, whether it's cardiac problems, endocrine problems. So that's the beauty of the skin. It's really a window to what's on the inside of our body.
I'm sure, but the nails too?
nails too. Nails and hair as well.
What does that mean?
Well, I mean, nails, you may see breaking of the nails, color changes to the nails. The hair, you may see loss of hair, thinning of hair in different areas, loss of eyebrows, all kinds of things.
Yes, you certainly do. I know with thyroid, if you're hypothyroid, the hair can thin, things like that.
Exactly.
And the treatments people undergo, if somebody's undergoing chemo or radiation and there's some damage from that, can you help with that?
It depends.
At a dermatological level?
It depends. I mean, for example, for chemotherapy, where women will lose their hair, for example, with breast cancer treatments, that will generally regrow. But even an interest there is sometimes the hair, which may have been straight, will go back curly.
Yes.
So there are things we don't understand, but it's these mechanisms that we don't understand which lead us to new information and new knowledge.
I'm sure anytime you're putting a chemical in your body, such as a chemochemical, it must do some skin damage, a little bit.
It can,
here or
and
there.
you can have rashes from chemotherapy. You can have what's called radiation recall reaction. So if somebody has radiation and they have a drug and they have a reaction to that drug, it may only appear where they had the radiation, for example. Or people who've had radiation may get sunburnt more easily in those areas. So
Sure.
all kinds of things.
I know when you're going through chemo, they tell you to stay out of the sun because you could be more reactive.
Exactly.
What does sun rash mean? Somebody's in the sun too much, or they're allergic to the sun? Is there such a thing?
Well, there are different types of rashes which occur because of sun exposure. Common ones are occurring in women. It's called polymorphic light eruption. And this occurs usually early in the summertime before the skin gets used to sunlight exposure. And it can be an itchy, bumpy rash that occurs on sun-exposed areas. Usually comes on in a couple of hours after exposure and will go away within about 24 hours after being out of the sun. Another rash from the sun is like lupus, which you can get on the face. And systemic lupus may first manifest as a red rash on the cheeks, but then people can have renal problems with it, kidney problems, liver problems, joint problems, so all kinds of things.
We'll come back with Dr. Jason Rivers and talk more about skin care, and of course he'll tell you exactly how much lotion you need to prevent sun damage. I know you will. Okay.